I'm a GP that's been working in botany for the last 2 years or so. We've set up a new clinic there, but I've been a GP for about 12 years now. Yeah, so yeah, work across the breadth of general practice from antenatal shed care, newborn care, up until uh, got quite a few nursing home patients, so across the whole gamut of general practice. Yeah. Sure. So I think it's really about developing and maintaining that relationship and trust, and trying to work with the patient to understand their specific challenges and barriers to quitting smoking. Uh, Obviously, there's different points on the journey of cessation that people are at, and trying to set realistic targets, for wherever they're at that journey, or on that journey. You're trying to push them to the next point. I guess if they're at a point of not thinking about quitting, you're trying to get them to think about it and contemplate it. If they're thinking about it, you're trying to break that down into steps that they can do to try and stop smoking, or for them to understand what steps are involved. And then if they're actually trying to quit, I think trying to support them and encourage them. And then if they fail to quit, then just encouraging them to maybe not look back but look forward, and to have another go when they're ready. So I think my main role is to try and understand where they're at and try and read that, and then try and act on that point wherever they're at. Yeah. It sort of changes the game a bit. I mean, we do way more kind of primary prevention for cancer. So you're always trying to stop the smoking before it's manifested any disease. So when you get to the point of having a diagnosis, um, it does change it a bit, because one, you can think, well, part of you might think, well, they got cancer now, why quit smoking? But the flip side of the coin is, well, the survival rates for a lot of cancers are a lot better now. So this can be an opportunity to say, well, look, smoking probably contributed, to your diagnosis. So, if we can get through this cancer, then, quitting smoking will probably improve your outcome with this current cancer, but also prevent you from getting another one later. So, yeah, there's that flip side. And again, it's about reading the patient, because you know they it's a big shock to their mental health getting the diagnosis. They might be putting on a brave face and a brave mask and things like that, but at some point, we're all mortal, and being confronted with your mortality is pretty hard. So, yeah, I think you've got to just try and deal with the cancer diagnosis initially, and then the smoking is still very hard. Obviously, it's super addictive. So trying to take one step at a time. I mean, some people will quit cold turkey, and that's fantastic and supporting. But I think the more common role with someone like with a GP would be, okay, well, maybe this is the opportunity to just push them that next step forward in the process, and say, okay, well, these are the options to help you quit. I think maintaining the relationship and the trust is always the important thing. So working together. So I think sadly, most people, it's very hard to change people most of the time. Or if change is going to occur, it takes a long time. So if somebody is difficult and doesn't want to do what I think they should do, I don't take that personally. I don't get frustrated by that. I just sort of kind of put it to the side and just keep moving along, and keep working with them. And that way, I think I'll just read that as saying, okay, they're not ready. And, at another point, we'll just bring it up. But it just means that they're closed at that point. And I think if you get defensive and really hammer it, it's going to drive a big wedge in your relationship, and then they might not feel comfortable talking about it with you again. Yeah. Having specific information about how smoking relates to that specific cancer is helpful. So I'm not an expert on which cancers are more likely, or what's the probability loading that smoking puts on each cancer. um, a decision tool or some information to support to say, okay, well, if you reduce smoking by x percentage or x number of cigarettes a day, it will reduce the likelihood, or increase your life by this many days, or something, something that kind of puts it in a tangible way would be handy. That would be handy. So you can, that way you can develop targets. Like, even if they don't fully quit, you could say, well, if you're smoking 20 a day and you cut that down to 10 a day, that might add another year to your life, or something like that. Like, you can sort of add a tangible number that people can hold on to. Yeah. So one is the loading of how smoking affects their specific illness, but also, it would be useful to know whether the oncology services themselves provide any specific smoking cessation support. Also, it would be useful to know whether the oncology services themselves provide any specific smoking cessation support. I'm a strong believer that if somebody's ready to quit, you just hit them with everything and try and support them. I mean, I can provide all the different pharmacotherapy supports. That's very easy. And there are some, uh, various different psychological supports that we can use, that we can employ. Some of them are more or less helpful than others. But sometimes within the public hospital systems, there are some really good like smoking psychologists, or even smoking therapists. But even if you had, like, some way that if you had a label of cancer, that would allow you to be fast tracked into one of those specific clinics where you have somebody who's quite, nuanced at providing specialist advice. If somebody was ready to go, not for everybody, but just as an option, that'd be handy. Like, often we get a summary of the multidisciplinary meeting, um, and then you could have tacked onto the bottom of that, if patient X is interested in quitting smoking, we note that they're a smoker. If they're interested in quitting smoking, this letter can serve as a referral to our specialist smoking cessation service run by blah. I don't know, something like that. Be handy, but I don't know if such services exist. I guess it would be useful to know whether there's any contraindications for any of the pharmacotherapy, particularly Champix, I guess. I mean, as far I mean, I don't know if I'd be doing right when somebody was, whether there is any, as much as you can when you at the point of prescribing. But look, I'm not an expert in chemotherapy, and I just can't stay abreast of it. It's too complicated, and often stuff is trial medication and things. So I mean, often the argument becomes, well, stopping smoking is probably better than side effects, but you don't want to be cavalier about it. So, if there's any contraindications to varenicline or any of the other, I mean, that's probably the biggest one. I mean, nicotine replacement therapy, I think, is pretty benign. Probably the main role would be planting the seed and then handing that over to the GP to water and cultivate. I, there's a there's going to be a lot of information that the oncologist will be providing with the patient. And often, if patients initially become a bit shell shocked, there's a lot of it, they just sort of, they might just hear their cancer diagnosis and be caught up in the treatment of that, and just not remember much of what else is said. So what one would be planting that seed, and then during kind of follow up, just I don't know if it's 6 monthly or annually or something like that. They can just just for themselves check. Oh, are you still smoking? Oh, okay. Have you chatted to your GP about that? Maybe you should chat to your GP about that. That way we can just work together. But I don't really think they should be trying to be responsible for the pharmacotherapy or the counseling, but they can, you know, if they have an in-house service to refer to, if the patient's ready, that'd be handy for me to know about. Um, but also just encouraging me if we or the GP to follow up and keep trying. Yeah.